Hi friends. Thank you for listening to us here at the QI Southeast Ohio Hub. We are here again with Dr. Jen Gwilym.
Hi, Sarah.
How are you today?
Great, how are you?
I'm very good, very good.
Good.
So today we're going to continue to talk about CGM adherence. So we have shown on our dashboard, we have shown with data that the prescriptions for CGMs have really gone up in Southeast Ohio, which is fantastic. That is what we have been working on with this QI Hub, is increasing prescriptions for CGMs. With those increased prescriptions, you probably are going to get a lot more questions about CGMs. How do I get it to stick? It keeps falling off. I have skin irritation. So we have brought Dr. Gwilym back to give us a few tips. We're going to talk about 4 different areas about CGM adhesion and sticking to the skin. We're going to talk about where it should be applied. We're going to talk about how to prepare that area. We're going to talk about how to maybe help it stick, and also maybe how to take it off if it's on really tight. So I'm gonna let Dr. Gwilym talk to us a little bit about those first couple items.
Great, thank you, Sarah. So first and foremost, I think it's always important that you read that manufacturer instructions that are inserted. So, make sure you pull those out. They're very easy to read and they have really nice diagrams, so your patient should be able to read that and figure out what's going on. That's the first and foremost.
Okay.
Secondly, washing your hands. I can't tell you this enough. I think after COVID, we really got into the habit of washing our hands more, which is great, but you want to make sure before you're handling this, you want to make sure you're washing those hands.
Okay.
Then you want to look at your skin and you want to determine where you want to put this. The most common areas that we see are really the backs of the arms, and I think this is a great place to put it. With being cognizant, you want to make sure that you're rotating these every 10 to 14 days to avoid, infections, lipodystrophy, all those things that we talked about in the last video.
Okay.
You also can put them in the abdominal area. We've seen people also put them on their back and their thighs. I kind of caution for those areas though. If you think about the abdominal area, if you're putting them there and you wear a tight shirt, you may rub that area.
Yeah.
Also, if you're putting them on your back, think about sitting back in a chair. That may be uncomfortable, sitting in a car and writing. Also on your thighs, if you happen to put on any pants that are fairly tight, jeans, that may also rub that area. So I really think arms are good.
Okay.
Also, thinking about how you sleep. If you sleep on your left side, I probably wouldn't put that on your left side. Okay. It's going to affect your sleep.
Yeah.
So those are some of the things as far as sight and where you would put those.
Yeah.
Other things to look for is make sure you have healthy skin in that area. Make sure you don't have a newly bruised area. Make sure you didn't just see me in the derm office and I biopsied you for cancer and you have an open area, because that can happen. I see people that come in all the time with new little puppies and new little cats and they like to scratch. Don't put these over those open areas because those are breeding grounds for infection.
Okay.
Other things then, once you pick your special site that you want to use, you want to make sure you clean that area with soap and water. Get it clean, let it dry it off with a nice clean towel.
Okay.
And then I do recommend alcohol.
Okay.
I would take an alcohol, wipe it around, because that's going to clean off more than just your normal daily dirt.
Okay.
You may have things like suntan lotion. You may have put lotion on your skin to make it soft. You want to get that off, and alcohol's going to help.
Okay.
I'd let that alcohol dry 15 to 30 seconds before you insert.
Okay.
And then taking that CGM out, putting it against the skin, gently but firm enough that you're going to be able to try to make that this stick.
Okay.
And also, one of the things that you and I have talked about, it's so important. I think if you have not, as a provider, tried actually inserting one of these, please do this so that you know what it feels like to insert this. It's a fairly painless process, but I think once you're in tune with that, you can really talk more to your patients about, hey, this is how it happened when I did it. So
it's super cool. It's actually super cool to apply.
Yeah.
So I've helped multiple patients at the pharmacy apply the CGM, and they've come in, they're like, I don't know how to do this. So read those instructions. I think that's huge, and understanding how it should look when you apply it. So once patients have this applied, we'll say that some people won't need to do more. That may be enough, right? That may be enough. It will stick. They'll have no problems. If they do run into problems, so if they're having trouble keeping it on or keeping it adhering, there are multiple options available to help that stick. You can actually use additional products to help it stick. You can use an overlay to help it stick. There are a lot of options for that, and that is not an uncommon thing. There are a lot of people that need to use additional measures to help that CGM stick to their skin. So once you have that on, you may have to use special things to take it off, depending on if you used additional adhesives of some kind underneath to keep that on. There are other things that will help take that off. So understand that there are a lot of additional products out there that can be used to help those CGMs stick. I would also recommend your local diabetes navigator has a lot of experience talking to patients about how to keep these on, and also your local diabetologist has a lot of experience. So as a provider, if you need to reach out to them, maybe a special patient case you need some additional assistance with, I'm sure that they would be open for those discussions. So we thought that this was an important topic to share. We have some patients who just need that extra stick on those CGMs. So thank you for joining us, Dr. Gwilym.
Thank you, Sarah.
It was good to see you.
You too.
And thank you so much for joining us, and I'll see you again, friends.